everyone. I'm Dr. John Perlin. Welcome to the fourth edition of A Physician's Lens. It's a video cast where we try to bring topics of interest to our frontline physicians and other caregivers. Today, we're really privileged to have with us Ed Jones, the head of our HealthTrust purchasing group. I can't think of a part of HCA which has been more important in terms of meeting the demands of COVID than assuring that we have supplies, essential personal protective equipment, at the very front lines of care for all of you in the care of the patients that we're privileged to serve. Ed has been a long-standing member of the HCA family, and before we talk a little bit about HealthTrust Purchasing Group, which you'll sometimes hear us call HPG, Ed, I was hoping you'd tell us a little bit about your history in HCA and how you came to your current role.
Well, thanks, Dr. Perlin. It's a real privilege to be here. I'm actually in my 37th year, and started out at a hospital a long time ago, and have had the distinct honor and privilege to work in the company in various roles, and have been here in Nashville at the corporate office for the last 20 years.
Well, I remember we were back together in Richmond, Virginia long ago, and I think it's that frontline experience that really makes you so sensitive to the needs of our caregivers every day. And this isn't your first rodeo in terms of supply chain shortages. There have been both shortages situations like the prior flu epidemic that have had to make us more prepared. What have we learned? What do we bring forward from that?
Well, I think the one thing I would say, when I reflect back on my own experience, I remember when I worked in a hospital that a nurse, in a very direct way, explained to me that in healthcare you couldn't give rain checks when you were out of key products. And that really has stuck with me my entire career. So as we at HCA and HealthTrust begin to prepare for things like hurricanes or fires or mass casualties or what have you, we spent a lot of time working with the clinical operations group and trying to run different scenarios to really try to get a line of sight of what type of products we need to be prepared to have and be able to scale that across the enterprise. And so I think that experience over the last several years has really kind of positioned us to really respond to this. Now, I would say that we've never faced anything like this in our entire career.
Over the past few years, we've had drug shortages, we've had shortages of chest tubes, and HealthTrust Purchasing Group has really worked magic to make sure we have supplies at the front lines.
Well, Dr. Perlin, if you think about it, when you step back to the avian flu that we experienced, several years ago, that really started to bring into our line of sight that we really needed to try to determine the products that we needed to create some level of a stockpile for. And so we started to do that. In addition to that, as we start looking at some of the other challenges that we faced, we really start to look at where the products are produced and what are the opportunities for us to de-risk the supply chain. And so we've tried to spend a lot of time identifying those and start to stratify those across the country as well as the globe to try to come up with different strategies to provide products. What's interesting enough, if you go back to last fall, because of the tariffs, we started an exercise in de-risking the supply chain from a tariff perspective. We started to identify all of those products that were being produced in China and looking at other alternatives because we knew that the tariffs could put additional pressure on the pricing of those products. That exercise actually served us very well as we started to face and deal with this most recent pandemic.
Well, that's terrific, and we appreciate that really heroic preparation because of the incredible consolidation of the supply chain, not only in terms of a limited number of manufacturers, but as we've all learned, the geographic consolidation as well. One of our best tools to deal with these challenges is that we think HCA Healthcare is a big operation, but HealthTrust Purchasing Group is enormous. Can you share with our colleagues a little about the scale of HealthTrust service, not only to HCA Healthcare, but to healthcare in the United States?
I'd be happy to, Dr. Perlin. So HealthTrust represents about 1,600 hospitals across the country. So if you take the stat that would suggest we have 5,500 hospitals across the organization, we basically have 27% of the U.S. hospital base in an exclusive relationship. We source about $45 billion worth of supplies on an annual basis, of which HCA makes up about $8 billion of that. So if you think about the scale of HCA being the largest healthcare provider in the country at $8 billion, we've been able to take and additional spend totaling up to $45 billion, which has really given us a lot of scale in the marketplace, not only from a pricing perspective, but also from a supply interruption perspective. And because of our scale and our size, we've been able to create a lot of agreements with our suppliers that have failure to supply language in those, in pharmaceuticals as well as some other key products, that hopefully gives us a little more protection with the supply chain as it becomes under more intense pressure.
So let's get a little bit more specific and granular. Everyone's focused on personal protective equipment, gowns, gloves, masks. Talk a little bit about how the change in guidance has really required you all to roll with the punches.
Well, I think that's an interesting perspective. I think for us, the one thing I would say is that when you think about this pandemic and what was so unique, you had global supply not being able to meet the global demand. So in other words, global demand was outstripping global supply. You couple that with the fact that the majority of all PPE equipment was produced in the Hubei province in Wuhan. Those two things coupled together really created a lot of challenges for us going forward. So one of the key things that we did early on is we recognized that we were really going to have to work and focus on the demand side of the equation to give the supply chain, the supply base, time to recover. And I think we did that incredibly well. I think the CDC issued some very strong guidance that were incredibly helpful. We partnered with our clinical operations group to really help to really determine how we could apply those standards inside of our own organizations to ensure, above all else, that we protect all of our caregivers so they could pay attention and focus on taking care of those patients at the bedside.
So this isn't theoretical. You've actually taken your team around the world, India, and in particular, in this instance, China, to actually observe manufacturing and make sure we have product. Tell us a little about those trips.
Yeah, I'll tell you, the one thing that we did about 10 years ago is we opened up a global sourcing office in Shanghai, China. And so we have about 8 people in that office. And all of the people there either have a sourcing or an engineer background. And over the last 10 years, we've spent a lot of time building relationships with the manufacturer base, really understanding the quality manufacturers versus the manufacturers that do not have FDA approval. We also gained a lot of insights to raw materials and how important raw materials are in the ultimate production of PPE and other goods. And so we've spent 10 years really understanding global sourcing in different parts of the world. And I've never been in a position where we've seen the value of having a global sourcing operation that we've seen and valued during this experience.
Yeah, that's really exceptional. So appreciate that. Let me flip it around a little bit. You watch us as caregivers at the front line use personal protective equipment, and we were obviously trained. Things were disposable, they were one use. This is a different environment. We've had to change our practices, and again, supply chain, HealthTrust purchasing group have been intricately involved in some of these new roles that not only we in HCA Healthcare, but really across the country are having to adopt in terms of preserving PPE.
Yeah, I think that, when I reflect on this, over this last 4 or 5 month journey, if you think about it, had we not instituted the conservation strategies and been very, very thoughtful and effective on that, ultimately we would have run out of PPE. And then where would we have been left? We would have had patients entering our hospitals without being able to protect our caregivers. And so I think that, as we try to look at the planning efforts back in February and March, we recognized that it was going to take some time for the supply chain, the supply base to catch up. And so we really focused on the demand side of the equation, and we started to see our inventory levels start to increase just by managing the demand. And then I think that over time, what we started to see is the supply base started to improve at the end of May, June, and July. And so when we went through this first period or this first phase, that demand management was incredibly important. And I think the key for us is that we really made sure we followed the CDC guidelines. We didn't make up the rules on the fly. We took what the CDC put in place as guidance, and then we took our caregivers, our clinical operations group, and our supply chain team, put them in a room to figure out how we were going to actually operationalize this during this first phase.
And I'm sure the guidance will continue to change. This is one of the things that's challenged you in supply chain, it's challenged us as care providers. because the guidance is changing. Well, we've had a lot of experience, unfortunately, with COVID. If wave one was kind of everything else shut down, wave two was really as people came to healthcare for heart disease and strokes, things that sadly they neglected during the first wave of COVID. I think we're anticipating a wave three as kids go back to school, as kids go back to universities, and people congregate. Who knows what's going to happen? How are we going to meet this next wave? What's your advice?
Well, I think that, the thing that we have tried to do throughout this pandemic is keep the foot on the gas on trying to secure the necessary product with the anticipation that we would see a surge in the fall. Interesting enough, we faced a surge before we really expected to. Now, the good news is back in the first phase of this pandemic, we already put in place plans to create a stockpile in preparation for the fall. So as the COVID cases started to decrease, the consumption of PPE started to decrease, we continued to buy at an accelerated rate as product became available. Now, the good news is that served us incredibly well as this second surge started to hit us. The one thing that was very challenging during that period of time, as Dr. Perlin mentioned, not only were we taking care of COVID patients, we also had all the other patients coming into our facility. And so we experienced, a lot of more patients, that were true isolation patients, which also put pressure on PPE consumption. And so the fact that we started to put together our stockpile plan in the first phase, we were able to access that during the second surge, and then we're continuing to build for the surge in the fall. And if you keep in mind that when we went back and started to look at alternative sources back in March, we recognized that this was going to be with us for some period of time. And so not only were we accessing what I'll call the normal traditional supply base, we started creating relationships with new manufacturing companies in the space. And so the good news on that is those products started to hit our shores in July and August, and we'll receive even additional product in September. In addition to that, we're working on a lot of plans to bring a portion of our PPE supply capability back to the U.S. And so we're really excited about the work there, and that should really help us, in the future, probably 2021.
Well, that's really exceptional, and we're so appreciative of what you've done to provide supplies to HCA Healthcare, the 1,600 other hospitals and health systems you serve. But you and our CEO, Sam Hazen, have also helped out the country. I remember seeing the pictures of you in the Rose Garden of the White House as you and Sam helped really to provide the initial allotment of 1,000 ventilators for the supply strategic stockpile equivalent, the dynamic ventilator reserve. Talk a little bit about that experience.
Well, that was not something you ever thought you would experience, but I think that what really kind of struck me in the very beginning is when the White House approached HCA and Sam for help. I'll never forget, Sam's view that, if my mother was in New York, I would certainly hope that someone would help her. And I think that, to me, just really kind of spoke to HCA and the culture, and kind of Sam's, his mindset at the time that if we had the ability to help, then we needed to take a leadership role to help do that. So we spent a lot of time inside of about 4 days with our team to try to determine, how would we create a dynamic ventilator reserve in order to really be nimble enough to be able to move ventilators around the country to meet the demand. And the HA did a lot of great work and with selecting technology, and the things that we worked on inside of HCA that ultimately became the approach that is supporting the country is the logistics aspect of that. And the thing that became clear to us, there were companies already in the space that do this for a living. The thing that was missing were the actual ventilators. And so what we were able to do was work with two of our key partners, and they were willing to basically step up and be that logistics arm to move ventilators across the country. And so, the good news is that we know that the ventilators have been moving around the country, have been meeting needs of those hospitals and those patients in those communities. And I think it also has given us a platform that, as we look at other types of situations that we could face in the future, that this approach could allow the healthcare community across the country to work together in a more specific way.
Well, really incredibly proud of what you've done. I think in healthcare more broadly, just like life, what goes around comes around, and contributing to the broader community is so incredibly important. I know as we film this, we're looking down the barrel of a hurricane coming at the country, and the sort of scale that you're able to bring allows us to really provision and be as safe as possible. And these are the things that are sort of transparent to us. We just expect the tools, the material, the protective equipment to be there, and it's people like you, Ed Jones, and your terrific team at HealthTrust Purchasing Group that make that possible. Thanks so much for being there in support of our shared mission, the care and improvement of human life. And finally, thanks to each of you, the caregivers at the very front lines of care who do your best every day, not only to care for COVID patients, not only to provide care in the face of hurricanes, but to meet the needs of your communities. We are so incredibly appreciative. We look forward to seeing you next time on A Physician's Lens.